Good morning, Manifesto and Strategy partners, colleagues and friends. My name is Mariam Schuler-Otschak. I'm the chair of the European Institute of Women's Health and professor of intercultural psychiatry at Charité Universitätsmedizin in Berlin, Germany. Just to inform you that the webinar is recorded. On behalf of the board and staff of the European Institute of Women's Health, I am delighted to welcome you all to this important event, the Women's Health Strategy Final Consultation. I would like to thank the more than 50 organizations who so far have supported the Manifesto for Women's Health and contributed to the draft Women's Health Strategy. We look forward to continuing this journey together. Today marks a significant milestone in our ongoing mission to place women's health in the center of European health policy. The objective of today's webinar is twofold. First, to introduce the final public consultation process for the EU Women's Health Strategy. Second, to foster meaningful dialogue among stakeholders, ensuring the strategy reflects the diverse experiences and needs for women and girls across Europe. Third, to add to the work that has been done by EU Commissioner for Gender Equality with the roadmap for women's rights to contribute to the FEM committee, a committee in the EU Parliament's Gender Inequalities in Health report and the SANCT committee report on women's health priorities. We are pleased to have with us a broad array of participants, from policymakers and healthcare professionals to researchers, patient advocates, and civil society representatives, all of whom play a vital role in shaping the future for women's health. The importance of women's health. Investing in women's health is not just a health issue. It is a social and economical imperative. Across Europe, women live longer than men, but spend more years in poor health. Chronic conditions like cardiovascular diseases, autoimmune disorders, osteoporosis, and mental health issues disproportionately affect women, yet too often go underdiagnosed or undertreated. For example, cardiovascular disease is the leading cause of death for women in Europe. Yet symptoms often present differently than in men and frequently overlooked. Women are more likely to suffer from long-term mental health conditions, particularly depression and anxiety, but access to appropriate support remains uneven. Additionally, research shows sex and gender differences are still not adequately integrated into medical research, medical education, clinical trials, and health innovation. These gaps are not just clinical, they are systemic. They stem from decades of underrepresentation, lack of data disaggregation by sex and gender, and insufficient attention to the broader determinants of health, including socioeconomic status, caregiving responsibilities, and violence against women. A transformative opportunity. The development of a dedicated EU Women's Health Strategy offers a unique opportunity to correct these long-standing inequities. It is our collective responsibility to ensure this strategy recognizes the full spectrum of women's health across the life course, embeds sex and gender considerations in all health policies and research, and drives forward actionable, measurable change that improves health outcomes for all women, regardless of age, background, sexual orientation, or geography. We look forward to your insights today as we work together toward a more inclusive, equitable, and responsive healthcare system for women across the EU. Thank you for joining us. And let's get started to reach the finish. To introduce our first keynote on gender equality and health. I'm very happy to pronounce or introduce now Melanie Hyde. It's great, Melanie, that you are here and supporting us. Melanie is an Australian Dutch human rights lawyer with over 15 years of experiences in humanitarian action, protection, gender equality, and human rights across 5 continents. She currently serves as the Technical Officer for Gender Equity and Human Rights at the WHO Regional Office for Europe, where she supports countries in strengthening health system to deliver right-based healthcare, address health inequities, and promote gender equality. So the floor is yours, Melanie.
Thanks very much, Miriam, for the very kind introduction. It's really a privilege to speak with you today on a matter that is both urgent and enduring, the health and well-being of women and girls across the WHO European region, which, as you may know, is slightly larger than the EU, and we have 53 member states. But despite some progress that we've made, women across the WHO European region continue to face persistent health inequities, as Miriam pointed out, inequities that are unjust, they are avoidable, and they're deeply rooted in gender norms, socioeconomic inequalities, and systemic biases. So in this light, we very much welcome renewed efforts, including by the European Institute of Women's Health, to strengthen health systems, policies and practices to improve the health and well-being of women and girls in our region. And we pledge our support to collaborate and to support these renewed efforts to create a Europe where all women and girls are empowered to achieve their full health potential, with their rights respected, protected, and fulfilled. Next slide, please. So I wanted to just go a little bit over the WHO European Strategy on Women's Health and Wellbeing, which provides a powerful evidence-based framework to address these challenges. The strategy, which many of you will know, was informed by the evidence that was gathered in a regional report called Beyond the Mortality Advantage that you can see there on the screen, and for which we were very lucky to have the European Institute of Women's Health and Peggy supporting us in terms of doing the consultation. And the strategy calls for a life course approach, gender responsive health systems, and intersectoral collaboration. And it's hard to believe that it's almost 10 years old, particularly because it's still so relevant today, and perhaps even more so given the gender backlash that we see across globally, but also our region. And the strategy itself has 4 priority areas. So one is looking at strengthening governance for women's health and well-being. So looking at collection and use of disaggregated data, as was mentioned by Miriam, transparency and accountability in clinical trials and health research, looking to eliminate discriminatory values, norms, and practices that really affect the health and well-being of girls and women. So policies, health providers, health promotion, norms transformation, tackling the impact of those other social determinants of health that were mentioned. Yeah. So looking at intersectional analysis, looking at social determinants around poverty and social exclusion, for example. And then finally, looking at improving that health system response. So supporting gender transformative policies and integrating services for gender-based violence survivors into our health systems. Next slide, please. So when we look at these 3 strategies, and I think what was really interesting for me to look at, you know, in synergy, the WHO strategy in synergy with the draft strategy from the European Institute for Women's Health and the EU roadmap for women's rights, I think they can really guide us towards a transformative collaborative action and really reflect a growing consensus, I think, that women's health is not a siloed issue, and that women's health is both a political one and has a technical agenda. And perhaps that's been why it's so difficult for us to kind of make progress on it. But I do see a shared vision, and something that I think is really important to see, and we've seen this shift, I guess, over the last 10 years, is really to adopt a life course approach. So each of the strategy really importantly promotes a life course approach to women's health that acknowledges that sex and gender combined with social and environmental determinants of health to influence how health risks and benefits accumulate through life. And this is key. So, for example, the WHO strategy works side by side with the WHO Action Plan for Sexual and Reproductive Health, but recognizes that the health and well-being of women and girls goes beyond maternal and child health. So we need to look at how sex and gender interact during puberty, during pregnancy, during menopause, all the stages of life across the life course of women. So together, I think these frameworks, I'm quite excited by where we can go with these frameworks, because they offer a coherent, evidence-based path forward. But we know that strategies alone are not enough. And what matters is implementation, collaboration, and most importantly, accountability. Next slide, please. So on this point on accountability, I think when we look to the future, we need to look at one of the most critical enablers of progress, which is robust monitoring and evaluation. And I think if you look at the WHO's 2023 Joint Final Progress Report, which is the report on the implementation of the strategy, it underscores this point quite emphatically. Without timely, disaggregated, and actionable data, we cannot track progress, identify gaps, or hold ourselves accountable. So despite all the commitments that were adopted by member states, the report reveals persistent gaps in sex disaggregated data across the region. So for example, fewer than half of the 28 gender-relevant sustainable development goal indicators are consistently reported. And even basic indicators around healthy life expectancy, tobacco use, or access to care are missing sex disaggregated data in many countries. This is a huge problem because it creates a data vacuum which obscures the true scale of gender inequalities and prevents us from evidence-based policy making. What are we doing about this? In 2024, we formally adopted the SAGE guidelines, have been integrating these globally. But many, many challenges remain, including the systematic underrepresentation of women in clinical trials and research, and how that research feeds into improved quality of care for women and girls, and ultimately better health outcomes. So we continue to work on these issues through our normative role in the development of evidence-based guidance, including recent guidance that was published for best practices in clinical trials, and new guidance that is coming on including pregnant and lactating women in clinical trials. Next slide, please. So yeah, we know there is a lot of work to do. We know that we can't do it alone, but we also know that we need to prioritize and focus on those areas where we see significant issues that are unaddressed. And one of these is to emphasize the need for health frameworks to effectively integrate violence against women prevention and response as a health issue. So we know that in the WHO European region, only 19 member states have comprehensive post-rape care in line with WHO guidance. And we know that siloed approaches do not work, and that the health sector must step up as part of an effective system of prevention and response, along with the justice and social sectors. And the magnitude of this problem is really reflected in the most recent EU-wide survey that you probably all read, published by EIWH, FRA, and Eurostat. And this, combined with the slow progress we've seen on the implementation of the Global Plan of Action to strengthen the role of health systems to address violence against women and girls, shows the need to continue to address violence as a public health issue. And this is why this has been prioritized for the next 5 years in the WHO European Programme of Work. And we are currently building commitments, political commitments from ministers of health across the region to ensure that every survivor can access high quality healthcare without discrimination. And you see some of the ministers of health from the EU up here on the screen that have committed to support that initiative. I think one of the things that, when we talk about what we can do, low-hanging fruit, I was recently at a meeting discussing administrative indicators with EIGA. And even in the EU, we do not have one single indicator that can be used across the EU for the health sector. So we really need to get to a point where countries can report on the percentage of health facilities that offer comprehensive post-rape care, for example, in line with WHO guidance, and then look at aggregate numbers for service uptake. And that's something that's really easy to do if we would come together and integrate violence against women into the health system response. So we really welcome the shared focus on this issue with the EU, with the European Institute for Women's Health, and we will be working hand in hand with you and our member states from across the region to ensure that this becomes a reality. So thank you very much. And again, I'm very grateful to be here with you today and look forward to the exciting discussions.
To it when we start with the discussion part. Thank you so much. We are going on with our next speaker, who is Rebecca Moore. Rebecca is health economist and senior researcher at the European Institute of Women's Health. Rebecca has been responsible for many EU-funded projects and has expertise in gender in women's health across the life course, cancer, HTA, real-world data, and health literacy. Rebecca represents the European Institute of Women's Health at the EMA, DG, Sante, HTA network, and ECDC. And Rebecca, the floor is now yours, and your talk will be the European Institute of Women's Health, EU Women's Health Strategy, a brief overview. So the floor is now yours, Rebecca.
Thank you very much, Miriam, for your introduction, and also thank you to Melanie for your previous presentation, which was very interesting. And as Miriam said, I look forward to discussing it later on when I finish mine and the other presentations as well. So what I'm going to do today is just give you an overview of the EU Women's Health Strategy, a comprehensive approach. I hope that you've all had a chance to read it, or at least look through it. So we'll have good discussions on it today. But anyway, I'll just recap it for you, the highlights. So if I could have the next slide, please. The timeline, how this came about, is back in April 2024, our manifesto for women's health was launched. We decided to release it prior to the EU elections to create an awareness during the elections, and also get the MEPs to share our commitment to women's health issues, and also have key stakeholders sign up to it. In January 2025, we had the launch of the MEPs for Women's Health interest groups. This is a cross-party support for women's health across the EU, and the reason for it is to strengthen the political backing of the manifesto and consequently the strategy as well. So in February and March of this year, this strategy development begins. We circulated a survey to all the manifesto signatories, and we had an agreement on the outline and the scope of the strategy. And a first draft was prepared and also shared for comments. In April, we had a consultation on content, and we had a survey on the content distribution and input from a broad range of stakeholders as well. And this brings us down to today, which is the final consultation meeting that we decided to have open today with an open floor for everyone to discuss. So next slide, please. So to give you a context and the urgency about this, we just decided to have 3 points that are very important. It's like Melanie mentioned as well, it's the biological differences, it's aging population and societal pressures that lead to unique health challenges for women, with the life course approach being so central. And also that the current EU national policies, they don't adequately address these challenges enough. And that's why it is time for coordinated action. And this is what we aim to achieve with this strategy. Next slide, please. With the strategy, we have strong guiding principles. We want to promote intersectionality and collaboration between stakeholders and policymakers, and of course, women themselves. We want to bridge research and practice through knowledge and exchange, and this goes also back to what Melanie mentioned. We also want to improve the economic and social outcomes by enhancing women's health and realize the union of equality that the Commission has called it. Next slide, please. We need policy leadership and strategy. We need the European Commission to communicate on the state of women's health in the EU. We need a comprehensive EU women's health strategy so that the EU applies this on a pan-European group. We also need to have expert-led research and innovation agenda for women's health. And also we need to make sex, gender, and age disaggregated data for funding a requirement to be included. And also we need to look at the opportunity cost of not investing in women's health. What does it cost to leave this important, huge part of healthcare unresearched and unmonitored? And next slide, please. What we want on national level then is for the EU to be able to help all EU countries to be able to have their own national women's health strategies or action plans, that there should be a link to these strategies to access EU funding for the various components of the national strategies, and also to facilitate and promote the exchange of best practices for each country strategy. Next slide, please. Also, we want this to be intersectional and also mainstream. Women's health intersects with basically all walks of life. So we want it to be incorporated into policy and data areas, and also to include diverse stakeholders in decision making, that you get the voices of ordinary people heard as well, and not top down. And as I said, health in all policies and gender mainstreaming as well. So next slide, please. And to be able to do this, to have accountability and awareness, we want institutional coordination and awareness. We want to involve the European Commission, the Director Generals, and also the European Parliament committees, such as the FEM Committee, the Santé Committee, and also the Women's Health Interest Group, of course. And also, we would like to introduce a European Gender and Health Equity Week every year. And we want the year 2027 to be designated the Year of Women's Health. Next slide, please. Also going forward, which is going to be of huge importance, and where we see in the research we've been doing on various EU projects and also research on our own, there is a big divide with the intersectionality affecting women with regards to digital health literacy. And so what we would like is the Gender Perspective and Digital Agenda 2020 and 2030. We need to get AI to be trained on gender. We need to include age disaggregated data here as well. And we need co-creation to make sure that all research going forward, real world data and AI, has been co-created, including gender experts and women's health experts as well. And of course, we need to support femtech and, very importantly, safe digital access as well to all. Next slide, please. And research and education, we need to collect gender and age disaggregated data in public health as well as in clinical trials. It needs to be collected everywhere so we can monitor progress. We can see that and we can see what is actually being done. We also need to focus on migrants and minorities and other vulnerable groups. They can get lost in the data otherwise, so it's highly important for their sake. And also gender sensitive healthcare professional training through mechanisms such as the EU for Health. But this is where it starts in healthcare as well. It needs to be taught at the very beginning. Next slide, please. What we'd like to do, it's obviously a life course approach, but there are certain areas that we feel or that we are focusing on. It's clinical trials inclusivity, vaccine preventable diseases, including cancers as well, antimicrobial resistance awareness, where gender plays a huge role, and you will also have issues with minorities and vulnerable groups going forward, maternal and childhood obesity, and non-communicable diseases such as cardiovascular disease, which is the #1 killer of women. And the next slide to continue. Areas we want to maternal health services to be aligned with the WHO guidances, like I mentioned before, to take a life course approach to all women's health. The menopause needs to be included, workplace support and awareness campaign of this important part in a woman's life, and also sexual and reproductive health, access to health care, and very importantly, destigmatization of this. And also for young women, we have a fabulous young women's health group that you'll be hearing from later on. And one of the areas they have highlighted is menstrual health, which we've known about, but you'll hear from them. And also sexually transmitted infections. We need prevention, we need testing, and again, stigma reductions for these as well. And we should align also with our work with the WHO and the Sustainable Development Goals as well. So next slide, please. So how can we get the EU to help and engage? Well, what we want is to have these EU mechanisms with engagement. So to strengthen the European Parliament's Women's Health Interest Group. And also we'd like to engage the EU presidencies in women's health agenda. So it becomes a part of the Commission's work as well at high level, and apply gender transformative and apply the gender transformative lens across all EU funds and all programs, that becomes just part of anything that's being created. Always have the EU lens in any program. So next slide, please. And so to conclude this, our call to action is to have a bold, inclusive EU women's health strategy that benefits absolutely everyone, and to make women's health a priority for a healthier Europe. We want the European Council, the European Parliament, and all stakeholders to join our collective effort to make this a union of equality, to make the union of equality a reality by actually implementing existing and future recommendations that we've come up with, and engaging in a long-term and collaborative approach. So the EIWH Manifesto and Strategy Partners thus calls for the European Commission, the European Parliament, the Council, the European agencies, and like-minded stakeholders and partners across the EU to join our efforts and turn this ambitious strategy into reality, delivering better health for women and benefiting the whole society. Thank you.
Thank you very much, Rebecca, for this really comprehensive overview of the Women's Health Strategy. It is great to see what is in this strategy included. So thank you very much. We are going now to brief inputs on selected topics on women's health. Our next speaker is Martina Alberani. She is medical doctor, currently public health, resident and research at the University of Bologna with a background in medicine, public health, and healthcare communication. She is currently completing a Master of Public Health at the Imperial College in London, UK, and she is currently serves as chair of the Young Women's Health Group, an initiative supported by the European Institute of Women's Health, where she works to amplify the voices of young women in health policy. So, Martina, we are looking forward to listening to your talk on a life course approach, young women's perspective on health.
Thank you so much. And thank you to the European Institute for inviting us for bringing us together today, and mostly for their precious work they're doing daily. It's really an honor to be here today among colleagues, advocates, and allies committed to shaping a more equitable vision for women's health in Europe. As mentioned, I speak today on behalf of the Young Women's Health Group. We were formed with a very simple but essential mission, which is to bring forward the voices of young women whose needs remain too often deprioritized in policy discussion. Our presence here is grounded in the understanding that health is political, and young women's health must be recognized as a political priority. We know that the life course approach is essential, recognizing that women's health evolves over time and that early investments lead to long-term well-being and equity. We also firmly believe in the value of data to better understand the phenomenon. So here are a few to better frame the issue young women in Europe are facing. Today, gender-based violence has been referred to as a public health crisis. We couldn't agree more. 35% of women aged 18 to 29 in the EU have experienced gender-based violence, and over 40% report sexual harassment at work. As we sadly know, violence, whether physical or psychological, leaves deep and lasting marks on health, increasing the risk of depression, PTSD, to name a few. Talking about mental health, we know that anxiety, depression, and eating disorders are on the rise in young women. But we will also like to mention neurodivergence, which is another key area that's only recently gaining visibility. Neurodivergent girls and women, especially those with ADHD and autism, are often underdiagnosed or misdiagnosed, despite facing a higher risk of mood disorders, anxiety, eating disorders, and addiction. We also know that the gender pay gap still stands at 13% in the EU. As we know, income inequality has a direct impact on health, affecting access to care, autonomy, and long-term well-being. An outstanding example, contraception is not reimbursed in most of the EU countries under national health programs. As young women are usually students or early career individuals, many face financial limitations that restrict access. Moreover, only 39% of countries provide comprehensive online contraceptive information. What does this mean? This means that many young women face financial, cultural, and structural barriers to accepting contraception, to owning their fertility, and to having autonomy over their bodies. Why do this gap persist? We ask ourselves. It was already mentioned today that women continue to be underrepresented in research and clinical trials. And that's especially true for young and older women. A recent study found that in trials published in 2017, so only 8 years ago, in several key medical areas, women, especially younger and older women, continue to be excluded. Moreover, just 30% circa of participants in phase 1 clinical trials are women. These trials test safety in individuals. So if women are left out, safety data will surely be missing. To put things in perspective, on PubMed, there are 4 times more studies on erectile dysfunction than on premenstrual syndromes, even though over 80% of women report symptoms. And unfortunately, this has consequences. So we're still seeing delays in the diagnosis of endometriosis, ranging as per today 7 to 9 years, according to the latest data. Finally, a very recent study made by Dr. Punzi and Dr. Spoer and supported by Reglet Leventer and recently presented at the European Parliament highlighted the reality of menstrual poverty in Europe. In countries like Germany and Spain, 1 in 4 women struggles to afford menstrual products. In Belgium and France, 1 in 3. Moreover, between 5% and 20% of girls have missed school because they couldn't access the product they needed. So what are the young women seeing as a priority? Over the last few months, we have worked with peers across Europe to identify key priorities, reflecting the lived experience of young women. First of all, we firmly believe that we need comprehensive education on young women's health, including mental health, fertility, nutrition, body image, and much more. Education means empowerment, and empowerment means freedom and autonomy over our own bodies. Medical research must become more inclusive. Young women deserve to know whether and how drugs affect them differently, and they should be empowered to advocate for better representation. Also, access to safe and affordable contraception must be guaranteed, alongside investment in innovative solutions that empower young women to take control of their bodies and their future. Mental health support needs to be proactive, community-based, and youth-centered. We must understand how issues like anxiety, self-harm, or eating disorder manifest differently. This includes a timely and accurate diagnosis for neurodivergent young women. We shouldn't struggle so much in a society that often refuses to recognize their needs. Lastly, earlier this year, the Young Women's Health Group identified menstrual health as a core priority, as it intersects with broader health inequities, ranging from lack of education and stigma to diagnostic delays, symptom dismissal, research exclusion, and also affordability of care and menstrual products. We are now proud to be co-creating a policy manifesto with young people across Europe, calling for dedicated research funding, economic support, safe environment, regulated menstrual products, and much more. Very importantly, and to conclude, all of these priorities must be approached to an intersectional lens. We believe that there cannot be meaningful health equity without considering the needs of the LGBTQIA community, the migrant community, racialized group, unhoused people, who are too often excluded from policy conversation and data collection. We also firmly believe, and because of that, we are especially happy to be here today contributing to this strategy, that it is vital that the young women perspective are not just considered, but heard, believed, and represented, so that can actively shape health policy and inclusive health systems. Thank you so much for listening. Thank you for this opportunity, and we can wait to continue this work together. Thank you.
Thank you very much, Martina, for this really very impressive talk, making young women visible, giving them voice, and of course, representing them and giving them a perspective is also very, very important. Thank you so much. We are going on with our next speaker. It is Dr. Valerie McCormack. She is a cancer epidemiologist and the deputy branch head of the Environment and Lifestyle Epidemiology branch at the International Agency for Research on Cancer in Lyon, France. She has a PhD in epidemiology from the London School of Hygiene and Tropical Medicine. Dr. McCormack's research focuses on breast cancer survival, particularly in sub-Saharan Africa, esophageal cancer in East and Southern Africa, cancer survivorship in research, improving women's cancer literacy, and she leads several international collaborations and large-scale studies, including the ESCAPE study, a 22-country investigation into the determinants of breast density and the African breast cancer disparities in outcomes cohort. Recently, the International Agency for Research on Cancer has launched fact sheets on socioeconomic inequalities in cancer mortality. And Dr. McCormack's topic or talk is on non-communicable diseases, women in and cancer. So the floor is yours, Valerie.
Thank you very much, and thank you for the invitation to speak. As you can see, I'm a little bit of an outsider because I am very much focused on sub-Saharan Africa in my cancer research, but many of the issues are common to many regions. This disproportionate the need to deal with women's health specifically, and I think your roadmap in Europe could really be a great example to the rest of the world. But I will try to make some comments more about Europe. So I'm delighted to touch upon cancer, one of the leading causes of premature mortality. And in very simple terms, 1 in 4 women in Europe will be diagnosed with cancer in her lifetime, and 1 in 10 will die from it. I mean, just in this call alone, that's a lot of women who will get cancer, a serious disease, which can kill and hopefully won't kill because survival rates are very good, but whose treatment takes a long time out of your life, and has long-lasting effects beyond cancer. So specific attention to cancer in women is needed for multiple reasons. And first and foremost is that the female reproductive organs and the hormonal influences are major drivers of the cancer burden in women. 40% of cancers in women in Europe come from the female organs. And a statistic really less known is that at young and middle ages, women are far more disproportionately affected by cancer than men. So in our 20s, this is in Europe, in our 20s, 30s, 40s to the mid 50s, women are diagnosed with more cancers than men. And at age 40, the extent of this difference is not a small difference, that twice as many women are diagnosed with cancer as men at age 40. And these differences in low and middle income countries are actually of a larger magnitude and extend for much longer in life. And so secondly, regardless of the cancer type, cancer and its impacts in women have specific needs and concerns. With the long latency period for cancer, the life course approach to prevention is critical, and that's been echoed in many of the messages already today. Survival rates are good, but treatment does impact on quality of life in women in very specific ways, including on her fertility, psychology, body image, sexual life, bone health, etc. Third, while many cancers can be prevented, in my opinion, a very empowering message to women is how well we're doing when we consider cancers that are common to both sexes. So if we consider your colon, lung, everything that affect both sexes, common organs, worldwide, 3 million women die of cancer every year, but 5 million men die of cancer. So 2 million women less die of cancer each year when we stick to those sex common cancers. And that I feel like that's empowering, that we are doing a lot of things well. We do get many prevention. We're getting many of the prevention avenues correct, and we can extend these benefits to other women worldwide. That from 2 million less cancer deaths each year. So I just focused on deaths there, so we forget about the issues of overdiagnosis. And so we are getting many things right, and we can extend those positive prevention messages and lifestyles to other women. Lastly, and many echoing what much people have said here today, is I feel that the ideas, novel or even simple ideas to improve women's health will come from women. Thus, participation of women and leadership by women for women will be pivotal in delivering policies for cancer in women. Thank you very much.
Thank you very much, Valerie, for your really very impressive talk. It's shocking me that disproportionately women are affected by cancer, and of course we need much more specific prevention issues and so on. Thank you so much for raising up this very important topic. Now I'm very happy to hand over to our co-chair, Professor Rutger van der Gaak. He is co-chair of the European Institute of Women's Health and Emeritus Professor of Psychiatry at the Radboud University, Nijmegen in Netherlands. So, Rutger.
Thank you very much, Miriam. Thank you very much, Melanie, Rebecca, Martina, and Valerie for these very poignant introductions. I'm proud to be co-chair of the European Institute for Women's Health, which is much in line with the work I've been pursuing with my colleagues at the Radboud University Medical Center, where we've had a gender-sensitive medicine center for 25 years, where we have centers on domestic and sexual violence, and we are greatly involved in social determinants of health. It's a real pleasure to welcome you to this important discussion session, and I would like to begin by thanking all of you that have supported our manifesto and have given input for our strategy, partners, colleagues, friends. Women's health is not a niche issue, it's a social imperative. Today, we're not just talking about healthcare, we're talking about equity, dignity, and justice. Our shared goal is that to ensure that every woman at every stage of life receives the care, recognition, and policy attention she deserves. The documents that we have shaped are more than documents. They are catalysts for change. They reflect the experience, the expertise, the voices of women all across the continent. And now it's time to turn that vision into action. So what I hope is that we're going to have a short but open, honest dialogue with bold ideas and shared learning. So we have a couple of questions about why you think it's important that we have this strategy. What can your organization contribute? What kind of impact we'll be hoping for? And especially, what are the steps we need to take? And to start off, I would like to give the floor to Jennifer Gillivan to comment on these questions. Thank you very much.
Good morning, everybody. Thank you so much for inviting Canada to the table to talk with you today. We are very much in support of your strategy, and we signed your manifesto. We input it into your strategy because we're trying to do exactly the same thing in Canada. And as you probably are aware, if you look at Canadian politics today, our own Prime Minister Carney, is actually in Brussels, I think, today. We are very much focused on partnering with Europe in trade and as an even deeper ally. So the timing is actually very good for us to be aligned on this very, very important topic. I agree with everything that's been presented. Thank you so much. My colleague Heather Creighton here is with me here as well this morning. I would maybe add a couple of points that I think might be interesting to consider. This is the largest unconscious bias in the world, and the average person, mainstream women and men, are not aware of it. They're assuming when they go to their doctor, they're assuming the drugs they take are equal. They're for their bodies. And in actual fact, that's not the case. And you are more educated on this than even I am, and you're well aware of it. We have a saying here, we need to educate. We need to educate women especially, but men as well, to advocate, then mobilize to equalize. People are always ahead of the politics. And what we don't want to do here in Canada is we know we have all the experts. We even have gender variable as part of our research, but it's not actually people aren't held accountable to it. We want to get the mainstream of Canadian people, and I would suggest the same in Europe, to understand this bias and the implications of what it has on your lifespan as a female and as gender diverse peoples. And we want them to be pushing their politicians as well as us. If we just only focus on I would call internal working with politicians, we can spend years talking about policies, and there'll always be a reason why it won't go through. The other area we're focusing very much on is both the economic drain. So, for example, in Canada, $3 billion a year is lost to menopause alone, but also the economic opportunity. We're in a stage in our history where Canada is talking about building bigger, building its own economy even stronger. We're dropping trade barriers with our provinces. which is all of those provinces run their healthcare systems differently. So it's a perfect time to push for this strategy. We currently have estimated conservatively, there's a $27 billion opportunity alone in the femtech industry, with no competition. Now, if anybody was to walk into any boardroom and give you that opportunity, surely people would jump on it. But for some reason, these women-led organizations cannot find the capital investment to actualize those opportunities. So as we push for this change scientifically, we're very focused on gender variable research. We're very focused on training in med schools. Currently, the 16 medical schools in Canada, only 9% of their curriculum is focused specifically on females. And the lack of drugs, I mean, it's over 75% of our women have the most adverse drug reactions in the country. I mean, it's when you boil all of the facts that you guys well know into simple English that people can actually understand on the street, they're outraged. And I say that if we join forces with organizations like yours in Europe and others around the world, this movement could be bigger than the suffragette movement, because women are done. They know how they feel. They just don't have the facts to match that feeling. And once they get that, it's powerful to watch what happens. And I will just
Well,
leave you with, people are always ahead of the politics. So as you almost have to parallel do the same thing. So we're pushing for a health strategy, but we've launched the fifth wave. It's a podcast that's basically going to enrage people to this inequity and educate them. We're doing point of view reports, and we're doing an economic statement that's going to come out in March of next year. So we're trying to work parallel and put the pressure so that the politicians actually then really start to wake up. You know, think about Beijing 30 years ago. Nothing much has changed in women's rights. They're drowning in talking about policy, but there's been no action. So what I really want for this strategy is to have action behind it. And the only way you get that is if you mobilize the general population. So that's what we're trying to do in Canada, and we're very honored to be learning from you and connected with you, and we will help you in any way we can from this country as well. So thank you for
wonderful.
listening to me this morning.
Wonderful. Thank you very much, Jennifer. And when I realize it's middle of the night at your place, I'm impressed by how you must be in daytime, you know. So there we go. I don't see hands yet. Who wants to make a statement? You can either raise your hands or put a question in the chat. And one of the things we're wondering is what benefits could a women's health strategy bring to your organization? That's the third question. The first one was about why it's dedicated and what the impact would be. But one of the things we really need to know is what contribution is your organization willing to make to this strategy? I'm looking at Mariela Catalano, and I think you want to say something.
Okay, I say, I'm working in VAS, which is dedicated to vascular diseases. So I have to make a short introduction. We have a very open mind, but sometimes we focus on our disease because they are under equity as well. And the women's situation in vascular disease is worse. So take into consideration that about 50% or more of women have vascular diseases as well. So it's a very large point. From our point of view, it's very important to have a connection, and we really welcome to have commune way to work, not divided into different organizations, as very often happens. We think that we should have a commune. And when I say commune, I mean also from material point of view, because money in our situation don't exist. I think they are few everywhere. And to have a commune, materials to share is quite important. I think from cultural point of view, commune, also including commercial determinants position for women, is extremely important, and we can use them all together. Then everyone can speak about their specific area of interest. And that is one point. The second question is how to be coordinated. So if we have, or everyone have one idea, one project, how to be joined together. I think also scientific paper that we prepare can have an endorsement, a commune endorsement. So we have in every way show that there is a strong, how can I say, strong body on the back. So we are really linking from every point of view. The third point is research and data. I think that all the power is based on data. So, and I think we need more data. And so I think that the commune project of research for registers, we will discuss obviously together, but having specific areas, but being one, could be excellent because it can have a high quality, because we can discuss, it can be supported in some way, we hope, by the Europe. And I think it can give us the data, because data are the basis for asking everything.
So if I
Not
understand
just
you,
to say women are many, we need to say women with are many, women with, and all the different aspects.
and if I understand you rightly, one of the things you're suggesting is that we should share more.
Yeah.
Yeah. Okay. Naomi, you put up your hand, then you disappeared, but luckily you're back. And
I'm back.
afterwards, I got Dorothea Dalich. The floor is yours, Naomi Ricci, if I pronounce it rightly.
Yeah, thank you so much, Ricci, but it's perfect like that, no worries. So I'm Noemi, and as Martina, I'm part of the Young Women's Health Group, but I'm raising this question from the organization I work for, which is DSW. I'm so happy to see this strategy comes to life and being here supporting it. So to answer the question 3, so what benefit could the women's health strategy bring to your organization? We are now working a lot on the low and income middle countries, and I've seen that the strategy. Thank you so much, Rebecca, for your excellent presentation. Also, is focusing on AMR and vaccine. So we have seen with COVID how everybody's linked, and health of neglected women in, for example, sub-Saharan Africa is very linked to European health, women's health. So our organization, for example, would be great to would be working on the women's health strategy and support this women's health strategy, also bringing a global perspective on it, which I think the strategy already has, since we talk about climate change and AMR and vaccine. So we would be happy to see that also on, since we were talking also about international cooperation, to see women's health also on programs, for example, targeting ODA, so the Organizational Development Goals, and on a EU global strategy level. So if we can bring that there, that would be great. Thank you so much.
And the vaccinations linked to what Valérie was talking about, because obviously there are vaccinations that can prevent cancer, which is a very important issue too. So I have Dorothee Dalich, and then afterwards Dalma Fabian. Dorothee, the floor is yours.
Yeah. Hi, thank you. Yeah, so my point is actually very much in line with what Mariella and Jennifer were saying, because I also very much agree that we need to share more. And also, when I was looking at the strategy, there's, and especially on the input that so many organizations gave, there's such an incredible amount of knowledge in this space. There is so much already, and there's also so much lacking.
Excuse my ignorance, Dorothee. I can't remember which organization you are from. So
I'm working for myself right now. I'm independent, but yeah,
well, that's an important organization too.
I work in women's health for quite some years now. So yeah, and yeah, so it's that's what I basically want to say. That there's so much knowledge, but it's sometimes not so well connected. And I feel like one of the goals of the strategy, I feel like, and the work we're doing here is to connect that knowledge. But I think also by sharing and by giving each other the knowledge that we have, that each organization has, we can also make each other so much richer. And in terms of implementing and partnering, I feel like that is also sometimes that on European level, we get very much in kind of like stuck in our own space. And then we need to bring it back to national level, to regional level. So partner with local women's health organizations to make sure that it is actually implemented at the level where people need the help and the support. And that I feel like we can also play a role in bringing all that knowledge together and then bringing it to a place where it can flourish. And also, as Jennifer is saying, like enrage the people that need to be enraged in order to have social change.
Okay, well, thank you very much. So now we move to Dalma Fabian, if I pronounce it rightly.
Yes, perfect. Thank you. Welcome, everyone, and thank you for this invitation, and thank you for the excellent presentation. I work for FANS, which is the European Federation of Homelessness Organization, and we work on women's homelessness. And we have also provided input for the strategy, and thank you again for that opportunity as well. So just want to highlight that women experiencing homelessness is a group along with others that face multiple and intersecting forms of disadvantage, such as housing instability, migration status, poverty, and gender-based violence, and they are invisible in health research and very much underserved by the healthcare system across the EU. So we very much welcome the intersectionality approach that was highlighted in the morning and the focus on social determinants of health. We very much would like housing highlighted as a key determinant of health. The example that was highlighted by Martina, the menstrual poverty, I think we agree that it's a very important issue, and it's a human rights issue, and every woman has a right to safe and healthy period, and we need to ensure that women have access to menstrual health products, but it is much more than access to products and availability of public bathrooms. I think it's an excellent example to highlight how we need to guarantee the right to housing as a key social determinant of health. So just wanted to highlight the health inequalities marginalized groups experience and how they are less likely to receive any preventative health care that was described today as well with the non-communicable diseases, and they do face exclusion and discrimination from mainstream services due to a multitude of different barriers, bureaucratic, legal barriers, or just the general lack of knowledge of their specific needs by health professionals. So just my question is that how can we ensure that all what has been said this morning and what's going into the strategy will also reach marginalized women and will deliver for marginalized women. Thank you.
Well, thank you very much for putting emphasis on these very vulnerable groups that are so often overlooked in policy, and thank you very much. So, who wants to contribute? Because it's not only how this strategy can benefit to your organization, but what your organization can contribute. And we have just 1 second. I don't know who is someone. W. Can I give you the floor? But I don't know. It says Women in Global Health. So who did the writing? She can do the talking now.
Can you hear me okay?
Yes, we can hear you very
Great.
well.
Yeah, thanks. I put the comment in because my internet's dropping occasionally.
Okay.
I'm in Italy, so I may just
Oh
freeze
dear.
at some point.
Uh-huh.
But really happy to be part of this discussion. We've been collaborating as Women in Global Health Ireland for some years with the European Institute of Women's Health, and Peggy McGuire's on our advisory board in Ireland. So we have a great strong connection. So Women in Global Health is this global movement, and Jennifer, your words spoke to me so much because this is exactly what the movement is trying to do, and it's about global level, but it's also about country level, and then women's groups right down to the community level, and that's of course where the action needs to happen. And the more people who are aware of the inequalities, the more they can find ways to respond to it. So yeah, I think you're absolutely right, and you said it also earlier. About this, unconscious bias that is just incredible, that so many people just really don't have any idea. So I think, this is a great opportunity to really raise this voice in Europe. As Women in Global Health, we also have a group of European chapters, which is quite active. So it includes, Germany, Austria, Norway, Sweden, Spain, Portugal, and Ireland, of course, and the UK, and Switzerland. And it's a very active group, and there is a lot going on in this space in these countries as well. And I think it's, we are actually working on an initiative coming up later this year to bring some of these voices together, and promote this in Europe. But of course, connecting with the politicians in Europe is also really important. And I think that's where the European Institute of Women's Health has a fantastic leverage. So, we would love to, we will collaborate. We've actually got a small team who've been going through the strategy, and we will send a few sort of written comments. But overall, we think that it's great. There's so much in there. As I said in my comment, it'd be great to have some really clear messages about what you want to get across, because it is quite a long document, and then people tend to sort of get a bit bored or get lost when they're going through it. So finding ways to make it, make things stand out, make the key points stand out, some of those data points, and then maybe start a section with, okay, here's the fact about this area, and here's what we want to do about it. So just sort of, and that might not be in the strategy, but it may be in a sort of a communication process that goes alongside to socialize it, to get people aware, and to really bring those messages out so clearly, because there's so much in there. It's such an important piece of work. So happy to support it in any way we can. Thank you.
Well, wonderful. Thank you very much. You make us more and more militant, Jennifer and you, because what I realize is a lot that we're discussing is in the rules. When you look at the EU rules, equity is center stage for already for 50 years, and we don't abide to our own rules. It's utterly frustrating.
Well, we'll always find a reason why not to support women. That's my experience in life. So we have to create the sense of urgency. We have to, you guys are amazing. The work you're doing is stellar. There's no question if you were given the will and the money and the power tomorrow, you could completely equalize women's healthcare. There's no question. The problem is that we have different, whether it's research, cures for HVP, you name it. Why isn't it happening? Because it's this unconscious systemic bias. And I just love that you're on here as a man, because we need more men. This cannot be siloed to be a woman's issue. We'll still be talking about it in, 20 years. And so I might sound militant. I'm actually originally from Ireland, so that I come by it honestly. Um, but my rationale is I'm in my early 60s. I have grandchildren. I have two daughters. I don't have time. My runway is getting shorter and I'm losing patience. So I'm really pushing this as hard as I can. I'm going to do this for the rest of my life. And so I just think that sense of urgency needs to be instilled in the communication simply to women and men, who then will go, what do you mean we don't have? And then they start asking the question. So we're coming at it from both sides in Canada. And I think just listening today, it's reinforcing that this is the right way to go. So thank you for that reinforcement.
Okay.
And we're here.
You can see my sense of Eurus. I'm halfway in my 70s, so the sense of urgency. Flora Pidou, you have a comment, please. The floor is yours, Flora.
Hi, thank you. Yeah, I have a comment because I've been following closely what EIWH has been doing, and of course there are great initiatives and a great plan of action that's being, of course, detailed now. But my question is, so there's great ambitions, but the question is, how do we make it happen, right? So we are building knowledge, we are gathering input. There would be the strategy. So a piece of or document outlining what we would like to see or what EIWH would like to see in European legislation. But how do we make that happen? What is the plan there? Like I mentioned in my quick question, the role of the MEPs for women's health is quite clear. But what is foreseen in terms of tangible advocacy activities at EU level? How is it planned for the Commission or the Council to be on board? And also more broadly, how can we support to make that happen?
Yeah. Well, one of the things was that we were waiting for 15 signatories, and we hope even more before the European Commission would consider receiving us to present the manifesto. But I think that Peggy will be addressing your question in 5 or 6 minutes. So there's time for others to ask questions that Peggy can answer. Who can I give the floor? Annette Dumas, you are very often in the European Parliament, so maybe you have a hunch as to how we can have more impact. Annette, are you there?
Yes, I'm there. I'm sorry, I won't put the camera on, but well, regarding the impact in the European Parliament, there will be a lot of raising of awareness through the interest group, that's for sure. But then I think we should make all the relevant dates that could be related to women's health, like the Gender Equality Week, for instance, as a big opportunity to influence the debates and further raise awareness with a very large public, whether it's the European Parliament, the Commission, and other like-minded stakeholders. Otherwise, I mean, we have these two reports in the Senate and the Committee on Women's Health and Women's Equality. We have the roadmap for women's rights that will be further developed, the gender equality strategy as well, the consultations on that. So we've got different leverage at EU level through the European Institute membership, but also through the European Parliament. Yeah.
Okay.
Maybe we could also envisage at some point maybe a hearing on women's health in the European Parliament. through the MEP interest group. So there are many ways we can further work with the interest group.
And do you think that things are starting to move, or is it just talking?
Honestly, I'm quite optimistic.
Okay, well,
because we've got all this development at Commission level on the gender equality strategy. There will be also some progress made in the area of LGBTIQ plus. There's, as I said, this roadmap. Currently, there's this disability discussion strategy. So yeah, we are on the good path, and I also would like to praise the Institute for doing that, because I remember a few years ago quite a number of years ago, but then when we had this women's health strategy in the European Parliament, that did bring a lot of outcomes and development. So I'm pretty optimistic that this one will also deliver.
wonderful.
It won't be done in 2 weeks, but anyway, it's in a good way. And we also have all the backing of the WHO work. So yeah, but the thing is that we have to keep on going. It's a relentless effort.
Absolutely. Thank you very much for sharing this, Annette. And I don't think we could have had a better introduction to Peggy's life work and the great impact she has had. And Peggy, you've heard all the presentations, you've heard the discussion, and now the floor is yours for wrapping up this webinar. We're very proud to have you on board and to contribute to the work that has been your life's work. And hopefully, as Annette said, and Jennifer, we're at the dawn of change.
Thank you very much, Rutger, and thank you very much for it was a treasure listening to everybody this morning and all the different topics that came up. And I have to apologise, my voice may go because I've had this kind of infection for the last couple of weeks, so I hope I don't annoy you by coughing every now and again. But I think, we're all on the same page here. I think, starting with the WHO and what they're talking about is, not working in silos, and we must share our knowledge and work together. We'll have a bigger impact. And I think that's come across from everybody today, from DSW, from Martina, from Valerie. There is a huge amount of knowledge out there, as Dorothea said, but we need to share it more. So we can't work in silos anymore. And to answer Flora, it's a huge undertaking that we've taken with the strategy, but we couldn't have done it without the contributions of the 50 organisations who signed up to the manifesto and also contributed to the development of this strategy. So moving forward, we have to have a women's health partnership. We can't do it on our own. Relatively speaking, we're a small organisation, so we need to work with the WHO, with ECDC, with EMA, with the Commission, with the MEPs for Women's Health. We need to work with all of these people so that we can have an impactful outcome from all of the work that's been done on this strategy over the last 18 months. Anyway, so moving forward, what we'd like to suggest to you, and of course it's a suggestion at the moment, is the formation of a women's health partnership across the EU, so that we can engage the manifesto and the strategy supporters, policymakers, NGOs, academia, professionals, patients, and agencies as well. So we can build this collaborative, inclusive structure. And the thing I find interesting, in coming from Jennifer and again from Naomi from DSW, this could be a very good model for a global strategy for women's health. I know, and we're working with Canada at the moment, and we're sharing and exchanging information and knowledge there. So hopefully that will increase in the future as well. So, I think, there's lots of opportunities there, but we cannot do it on our own. So what we're suggesting to all our colleagues out there is that we do form a coalition, a partnership on women's health, so we can move all of the recommendations in the strategy forward. And Paula from the Women in Global Health Ireland, I agree with you totally. There's still a lot of editing to be done on the strategy to make clear messaging so that there's no misunderstanding of exactly what we want to achieve moving forward. And for that, we want to make sure that we have everybody on board, and that we will have a terms of reference that we can send out and start working together on and moving things forward. And again, you know, the Institute is not a huge organization. And what we would like to see is this coalition where the Institute can be part of it. But we'll establish a steering group, a sort of a foundation, a founding group that can bring all of these recommendations forward at an EU level, so that we can oversee the strategic priorities and coordinate thematic groups, monitor and report progress. Just to give you an example of how we really need to move quickly, we are suggesting within this coalition, this partnership, that we have expert groups from all of you out there that we form. For example, give you an example. We've said in the manifesto, and I think we've spoken about this at various meetings, that the underrepresentation of women in clinical trials, what's lacking is the EMA needs to have guidelines for member states for the inclusion of women. It should be mandatory, really, the inclusion of women in clinical trials, and also how that can be implemented. And particularly that we have analysis of the results of clinical trials disaggregated by age, sex, and gender. And I think we could have a group who can work on that. From the manifesto and strategy contributors, we can start working on that. Secondly, we would like to put another group together who can put in a proposal or work with DG Research on moving forward with a women's research and innovation agenda. This goes back to reviewing, I suppose, what DG Research did 20 years ago and setting up an expert group on women's health, where we put together the wording for the guides for proposals and for funding, and also for the guide for evaluators. I think we need to go back and look at that again and see where the gaps are for that. So that's just two different ideas, but I think a lot of it is actually laid out in the strategy. But now we need the input from the Young Women's Health Group, DSW, FIANSA, so that we make sure that we do hear women's voices, because that's one of the main issues, is that we haven't heard women's voices at a policy level and women at a local, national and regional level. And I think that's where focal points come in at national level. We want to involve focal points at national level who are listening to women at local level, and have created action plans and strategies from the priorities outlined from women across the life course and across socioeconomic and geographic locations. And there are really good models of good practice out there. I'm always mentioning Ireland, but we do have a strategy here. We have a Women's Health Task Force in the Department of Health. Austria has one. Scotland, in the UK, I know they're not in the EU, but Australia has one, and now hopefully Canada, and we can support Canada in anything they need to do moving forward. So, I mean, there are models of good practice out there that we should be actually listening to these people. What have they done? What worked for them in different contexts? And encourage get them to get involved as well at a national level. But I think that's where we come into, we need the expertise to meet with the Commission and to talk about how we promote gender equality and gender equity at a national level. And this involves all the policies that they have already. As Rutger said, you know, it's already in since the Treaty of Rome over 60 years ago, and equality is already there. And in the Treaty of the European Union, it says that we're all entitled to the highest quality healthcare. We're not getting it. So I think we can actually quote European legislation and laws to actually advise the Commission that this is what they need to do moving forward. Excuse me. So we need to move forward. I'm just going to very quickly end here. We really need to work together, and we can't do it on our own. And we really will be writing out to you in the coming weeks to see if you want to become part of these different groups that will meet with the Commission. Will look at how to put together the recommendations of the strategy, and to talk to the EMA, ECDC, and other organisations. A lot of you have the expertise out there that we really need, and working together we can do that, so we're not working in silos. And I think one area that we should all be working on as well, I think the WHO are very strong, is gender-based violence. We have the directive there at a European level. We still need countries that can sign up. They haven't even signed up to the Istanbul Convention, which is crazy, because women and girls across the life course are still suffering. 1 in 3 women globally are suffering from gender-based violence. This needs to be looked at. But I think now's the time for shared leadership. It's not just the Institute. We need to share the leadership with you. So as Jennifer said, we can create this urgency, this voice that has to be listened to, really. And we cannot do this on our own. So we want to shape future of women's health together. We need to have shared leadership and collaborate really strongly at an European level, and have measurable, actionable outcomes. That's what the strategy is looking for. And as I think it was you, Melinda, said, implementation is the most important thing. We can have all the policies and legislation out there, but we need to have implementation and accountability. And that's not always there. It's not always monitored at the EU level and at national level. So we need to look at that. So I would plead with you to come and help us and give us your expertise. So over the next couple of weeks, we will be writing out and we will outline the different groups that we need to put together under this Women's Health Partnership or Coalition. It's a separate organisation from the Institute, we think, at the moment. But again, we'd like to talk to you about that as well, and that we can all be part of all different sectors and diverse. But we all look forward to working together for women's and girls' health and better health outcomes. Thank you very much, and thank you for showing up today. It's been a fantastic meeting. Thank you.
Thank you very much to all speakers and to all participants sharing with us your comments, your inputs, and your recommendations and suggestions and so on. It's a great pleasure for us having you on board and having your comments and so on, and finalizing our women's health strategy with your support. So thank you so much for all of you, and have a nice day, and thank you again. It's great, hopefully, to see you soon again.
Thank you.
Thank you.
Thank you very much.
Thank you very much. Thank you.
Bye-bye. Take care.
Thank you, everyone.